Hello. Hi, everybody.
Hello, ma'am.
Hello. Okay. So happy to see everybody here. If anybody can join on camera, that would be great. If not, that's also all right. So today I have a workshop planned for everybody. Let me just share my screen and we'll get right into it. Okay. So today we're going to talk about something that not usually we discuss or come across, which is how to prepare ourselves for the first therapy session. Because a lot of people tell us how to go about the theories and everything in our colleges, but still we don't have any idea what to do when it comes to our first therapy session. So, my name is Vidika. I am a psychologist. As all of you must be aware, I work in a Polo hospital, and today I'm going to give you much more clarity into your journey as to first therapy session. Okay, so before we get into it, first thing first, I want to know all of you what all fears you usually get, and you can just raise your hand in the comments or in the chat box as well and let me know if these are common fears for all of you, such as the fear of what if the client doesn't talk, what if I don't have an answer for it, or what if they start crying, what if I don't say the right thing, what if they think I'm not competent. All these questions start to come in, right? There is a lot of nervousness attached to it. You start feeling anxiety. What if I go across and the client's not sharing? They're completely numb about this session. What do I do then? All these fears start to come in. I'm sure a lot of you must be facing them. Any experiences or anything, any other fears that you feel that you tend to feel, but I haven't shared it yet? Anything? कोई भी common fear जो लगता हो कि what if something goes wrong? Yes. Manisha, you can text in the group or the chat box what is the fear that we're talking about. Any fear, anything that you feel that comes across in the initial stages of therapy session. Anybody? Ria, Ananya.
Yes, ma'am. As you mentioned,
Sometimes the client may keep information to themselves, right? And or judge because we're a beginner. Correct. So as a trainee therapist, what if I'm not up to the mark or I don't use the right words? These are all the common fears. Correct. So the best part is today I'm going to help you and get a navigation into how to be able to handle such situations. Let's begin with what not to do first, because when we have a clarity of what not to do, we already know कि ये नहीं करना है, इस road पे नहीं जाना है. That brings us more clarity into what can I do more. So the top mistakes that a lot of therapists make, not just the trainee therapists, but also clinicians, experienced therapists sometimes make, is over advising versus therapeutic guidance. There is a huge difference, and it's very important as a therapist to understand that. Over advising refers to that have you tried journaling? What did your family say about it? Did you try talking to your family, or have you tried doing some hobbies? So this is me trying to make more advice to them that you can do these things before even letting them know what they actually want to feel. versus what therapeutic guidance talks about. Therapeutic guidance is more about that what makes you feel better, what has worked for you before. So this gives a more clarity to the client that you're trying to understand their ways of coping, their ways of functioning, rather than going into it directly from the perspective of, no, I will tell you what to do. Okay. Then next mistake, topmost mistake that a lot of therapists do is trying to fix everything in one session. That's a huge mistake when it comes to going into the first session itself, because first session itself is just trying to create a therapeutic relationship with the client. उससे ज़्यादा हमारा focus नहीं होना चाहिए. Also letting the client be aware of this fact is very important. उनको भी ये पता होना चाहिए कि first session में सब ठीक नहीं हो सकता. So trying to navigate into कि ये सारे resources या सारा detail या सारा trauma मुझे first session में पता चल जाए, it's too much. So don't try to fix things in the first session, just try to build a rapport with the client in the first session. Third is talking too much or versus holding space. बहुत टाइम स्टार्टिंग में इनिशियली आई यूज टू फेस दिस डिफिकल्टी एज वेल एज अ ट्रेनी थेरेपिस्ट. आई यूज टू कवर अप द गैप्स. तो कोई भी साइलेंस होता था बीच में while the client is thinking or maybe remembering a flashback or a memory, I used to, and sometimes a lot of therapists used to feel awkward and they try to fill in the gaps by saying something. But however, in therapy, through experience, I have realized that they don't need the silence to go away. They actually want the silence to get a clarity and understand what they're feeling, what was the emotions or things that disturbed them, and what they want to actually communicate to the therapist there and then. So, creating that and holding that space for the client is very important. So, talking too much will not give them that clarity. And especially the whole idea of a therapy session is to create a space for the client, not for us. Last, one more important thing that we usually overlook is overdiagnosing too early. Initially, early therapists tend to put in a checklist in their mind and try to put them in a box कि ये client anxiety में fall करेगा, ये client depression में fall करेगा, ये client OCD में fall करेगा या personality disorder में fall करेगा. But because of creating these diagnoses, you yourself are putting yourself in the box. कि अगर अच्छा मैंने self diagnosis कर भी लिया that okay this client is falling into this without even communicating to the client, you yourself have created a bias against them. Then your intervention will become narrowed. Your intervention will go into that okay this is the problem, I have to fix it this way. No, rather keep it for later. Stay curious. Staying curious helps you to understand okay even if they're going through certain diagnosis, still there are different other comorbidities present in the client that I need to work on or maybe try to handle them. For example, I had a client who had OCD. एंड क्योंकि हम OCD पे इतना ज़्यादा वर्क कर रहे थे, हमने ओवरलुक कर दिया दैट द क्लाइंट वाज आल्सो हैविंग डिफिकल्टीज इन देयर रिलेशनशिप. व्हेन आई स्टार्टेड वर्किंग ऑन देयर रिलेशनशिप, इवेंचुअली आई नोटिस दैट उनके OCD के सिम्टम्स अपने आप डिसॉल्व होने लग गए. So what was a comorbidity started working out as the main diagnosis started dissolving when I started working on those factors. So sometimes overdiagnosing too early can create a lot more problems for you as a therapist. So always try to put yourself in that box ki no, I want to stay curious even though I understand the symptoms are falling in this category. Still I don't want to diagnose the client yet. Okay. Any questions? Any other mistake that you tend to notice and you want to address or bring up right now? Okay, great. Let's move on. Now, I want you to think from a perspective of a client first. Let's say you are in the first therapy session and you are the client, you're not the therapist. These are the common thoughts of a client that they will witness. What am I supposed to talk about? Should I say everything all at once? There are the They are going to think I'm crazy. What if I cry? Is my therapist judging me? So all these skeptical ideas keep on coming in the client's mind because it's first session for them as well. So you as a therapist need to stay regulated and be open to all these kinds of questions and let them just talk. It's first important as a imagine yourself as a client. What would you want your therapist to say initially? What would you want them to make you feel? What would you want them to create a space for you? That would be comfort, right? That would be a rapport as a conversation, a space that you can talk about anything and everything. That's all they require. So go from the mindset of a person that if I was the client, what would I want in this situation? And that will make your roadmap very easy as a therapist because that will bring you clarity into कि मुझे कैसे proceed करना है. I want first the client to feel that warmth and comfort in this environment. Okay. And letting them know that this is a space where you can let out or talk about anything. It shouldn't always be that, okay, what are the problems or what brings you to a psychologist. If they want to talk about something that happened bad today, maybe in their day, they can talk about it freely. Okay. Now, the step one of our therapy is how to open the session. Now, I am going to give you a proper exact lines into it so that it helps you to understand what to say as a therapist. Now, I have created a abbreviation for this. It's called FIRST. Now, the first step here is friendly greeting, creating a rapport or an environment for them to feel welcome enough. For example, hi, I'm glad you're here today. Letting them know that you are welcoming also, not going overboard as well, and setting the warm tone in the room basically. Okay, maybe starting with a smile. Then comes I, which is the inform about confidentiality. Before you go into that, okay, tell me what brings you to a psychologist. Before that, before we begin, you should always let them know that I want to explain that how therapy works. This is a safe and confidential space. You can talk about anything and everything. This is what I, as a therapist, hold a space for you. So letting them know that what are the confidentiality rules and what they can expect from therapy is very important. Then reflect emotions early. This is very necessary because this gives that you are listening, you are there with the client. अगर आप सिर्फ nod करते रहोगे तो उससे client might feel that are you even listening or are you even there. Reflecting is very important. Reflecting your emotions such as I understand that must be hard for you. So even when they're sharing some problems or troubles, letting them know and have that space that it's okay. I understand. I'm here. I'm listening. I'm with you. All these give through reflection. Reflecting emotions becomes really important. Then slow pace. Again, the silence part is very important. Do not run away from the silence. The slow pace creates a security for them. That's okay, I can take my time to put together my thoughts. Because, especially with clients who have anxiety, they come very fidgety and they are rambled and they have high speed. So, even if the therapist is also in the high speed, they start to feel that okay, the therapist themselves is feeling a little anxious. So, holding down that space, slowing down your pace, slowing down your tone creates that vibe, okay, that I am here and I can take my time to think and put my thoughts together and put it across to the therapist. Okay. Lastly, turn control toward the client. Very important. Do not go about it that this is how therapy works. I want you to do this. I would suggest you go about this. No, nothing like that. Rather, giving them the control and asking them what would you like to work on? What would you like to talk about today? What brings you here as to a psychologist? What has been weighing on your shoulders? Anything that lets them have the autonomy to begin with. And if then they come across and feel confused that I don't know what to say or what to bring about, then that's your cue to let them know that it's okay to share about these certain things, or what was the last time when you felt these emotions. Then you take forward from there. Okay, so this is how you open the session. That's very important that you go through these factors, because only then the rapport is being established with the therapist and the client. Once you understand this format, then it becomes really easy and flowing for you and smooth for you to go forward, because we all have the case history formats, we have the history taking format, क्या क्या हमें पूछना है, क्या करना है. So before going into that, this is very important. Any questions up till now? You can raise your hand or you can speak up through the mic as well to let me know if there are questions. Great. Okay. Now, this is an important factor to understand what are the do's and don'ts of therapy, because this will help you to answer why it's important, why it's bothering for the client, and what might set a negative tone in the session. If you want the client to come back, there are certain do's that you need to take care of. First thing first is the soft tone, like I told you. The client's nervous system should feel safe. They should feel emotional safety when they're talking to you. They shouldn't, if the, for example, if I am your therapist and I'm talking like, okay, let's not, what do you, so there are so many ahs that I just said. That makes you feel that, okay, the therapist themselves is not regulated. Maybe they need some time, they need some breather, and that makes you feel unsafe. So, creating that soft, gentle tone is very important to help the client's nervous system know that they are safe to talk about or talk here in this space. Maintain a gentle eye contact. Very important. The client may not maintain a eye contact with you. The client may be shy, the client may be anxious, the client may be depressive, that they don't maintain eye contact with you. But as a therapist, it's my duty to maintain eye contact with them. Only then they will understand that it's okay to look in the eyes and talk. Even if you have to look into their eyes and shift and come back, that's okay. But maintain the eye contact that builds trust, that shows that you are present. Because if you are wandering your eyes here and there, or looking at your phone or your, let's say, your notes, or writing down your notes while you're looking at them, so that creates that, okay, she has certain checklist to do and she's doing that. No. Rather, you must have noticed me in the OPDs as well, that whenever I'm making notes, I'm more present with the client. And once I get my pause or silence, or when they are in their own thoughts, that's when I write down my notes. Or even if I'm writing down, I'm looking at the client. So that's very important to create that trust, to build that active presence in the session. Slow pace of the speech, again, to create calmness, allowing processing time, letting them know that it's okay to take their own space. There is no hurry, there is no gap filling that we're doing in this session. Gentle smiling also sets the tone. It creates warmth and approachability, and let them know, especially with adolescents. Teenage clients will be very closed up, they will not look at you, they will be in their phones, or they will look for the time to leave the session. But with them, you have to create this gentle space that it's okay, it's comfortable. Even they will get uncomfortable in the silence. Letting them have that silence, that it's okay, just sit here and feel relaxed. That's more important. Letting them know that just having normal conversation about what you like or don't like is also enough in the first session to build the rapport. Now, the most important part, don't part. In your first session, do not jump into the trauma immediately, because it overwhelms the client, it breaks their safety needs, it creates a siren around them that, oh my God, I'm going back into those flashbacks. Because a lot of time we don't have that much time to go over every traumatic memory, and the wounds may stay open after our session as well, and this might create more anxiety for them. So it's better that we don't jump into it. If they bring it up, that's okay. You don't go into the robotic or over questioning mode there. You create a space that, okay, I understand. What else would you like to talk about? Let them have the autonomy to choose to talk about it. But you don't question or go into it right in the first session. Second, do not sound robotic. What I mean by robotic here is कि हमें कॉलेज से या यूनिवर्सिटीज़ में से या फिर हॉस्पिटल के केस हिस्ट्री फॉर्मेट के हिसाब से हमें एक फॉर्मेट मिल जाता है that this is your format of केस हिस्ट्री टेकिंग. उसमें आप सोशियो डेमोग्राफिक्स पूछो, चीफ कंप्लेंट्स पूछो, HOPI लिखो, ट्रीटमेंट हिस्ट्री लिखो, फैमिली हिस्ट्री लिखो एंड गेट डन विद इट. नो, दैट साउंड्स वेरी रोबोटिक. अगर आप उस फॉर्मेट को फॉलो करोगे द क्लाइंट विल नॉट कम बैक टू यू or feel connected to you in the next session. So create it more conversational, that they also feel that, okay, I'm having a conversation, I'm not jumping around, or I'm not feeling that I'm talking to a computer and they have set of questions ready and I just have to answer or blabber into it. Next important thing, do not over interrogate. That happens a lot in the first session. As trainee therapist, because we want to fill in the gaps, or maybe we have a checklist of that I want a whole history of the client, that's why we go into the over interrogation part, where we start interrogating about what to do, where to do, how to talk about it, and we may even start feeling the need to police question that, okay, after this what happened, right after this what happened. So that's not how it should be. It should feel more welcoming, conversational, and developing eventually after every conversation. Okay. This is a formula that I have created for my therapy sessions, and it usually gives us an internal roadmap into how I want the sessions to proceed and how I have to go forward when I'm talking to a client for the first time. If you can keep this in mind, this will help you throughout the session. It will create a safe space in your mind that I know what I'm taking care of and what are the major pointers that I need to cover. Like I discussed initially, first thing first is the rapport that we're building with the client. Very important. Then comes explaining the confidentiality. Then comes the story. Now, the client is going to ramble on and on and on about their story from their life till everything that is happening to the cup of coffee that they had in the morning. It's on you as a therapist that what you pick on and what you want to keep it as a stressor or a symptom or a timeline important factor. So, having that much awareness while you're listening to that story is very important. So, while they're telling the story, keep on writing down the stressors that are coming in, the triggers that might have aligned, and the timeline as to when happened what. Because they will keep on going and going and going. For you to notice and understand, okay, this year this happened, this year contributed to this symptom, this year this happened, is what a therapist work comes in. While you're listening to that story and creating the timeline comes the goals and the objectives. So for example, if the client is telling me that they are having relationship issues, for me it gives a clarity as a therapist that I have to build goals related to communication patterns and how to work through in a relationship and the attachment styles that I need to focus on. Or, for example, if a client is having anxiety attack, it gives me clarity into building approaches and goals, how to help them get symptom reduction in the next few sessions. So, while they're telling me their triggers and their symptoms, I'm also simultaneously building my goals and objectives for them. Again, I'm going to let them have the space while I'm reflecting and summarizing whatever they have told me in the session. I'm going to let them have the space and autonomy to choose which goals they want to work on. If they want to pick on certain goals and work on them, great. If they have something in their own mind, then we pick on from those as well, right? And then by the end of the session, I end it on a safe note by saying that it's something that can be worked on, it's something that can be navigated, and therapy helps them to become their own therapist, not to become dependent on the therapist. When you make them feel that safety by the end of the session, they will get the feeling that yes, I want to work on these certain factors, and they will come back to you. But this is basically how we create a roadmap or a formula of how your first session should look like. And you can always keep this in your back of the mind ready, so that while you're in the session, it gives you a sense of security that yes, I know what I'm here for and what is my goal for this one session. Okay. Any questions? Anything anybody wants to ask? Yes. Tell me, Manisha.
So, my question is sometimes when the client is going on about their story,
Yeah.
it's sometimes it's so rapid and they start dumping that it gets really difficult to keep a track of the timeline.
Hmm.
So, how do we exactly manage that? Because we also have to provide some sort of eye contact and make them feel heard. But at the same time, it gets really confusing because they're dumping so much information. So, how can we tackle that?
Okay, great. Good question. So, whenever they are going on about something and you have a timeline in front of you, but they're talking about something really overwhelming, and we need to maintain, like you said, body language as well, some cues as well, eye contact. While you're doing that, you can just write down the year that they have mentioned or the keywords we can note down that this year they had something, let's say they had difficulty in their college life, so you can do it, you can write in detail after the session closes, but at least in that moment, you have a moment to write about so that you're prepared that, okay, this is what I want to keep in mind. This happened first and then this happened. So keep ready with your keywords while you are in the session. Going in detail and writing about the whole HOPI or the timeline can go after the session, right after the session as well.
Okay, thank you.
Okay. Yes, Shreya.
Thank you so much, Pritika. It is definitely an enriching session. There is one thing that I have in my mind, keeping that in mind that whenever you are meeting the client, you are obviously not meeting for the first time. There are preceding sessions that we will be having with them. So, in that particular case, your rapport building, and the HOPI will take time. So
Yeah.
when we are taking the history is the basic part. It will take time. So keeping that in mind, they also come with a pre-assumption that within the first, second sessions, they might have the kind of clarification on their doubts or why they are coming to the therapy. And most of the time, we are also getting information enhanced, like how we have to do and how we have to proceed further. So in that particular case, how do I shorten the process of taking the client history and like having a proper understanding of it and then moving ahead?
Okay, so what I understand from your question, you're trying to say, how do I club it into a smaller session?
Yeah, yeah, because if I'm taking history today and a part of it, and the second time when I'm going with them, I'm taking again the history and the part of it. So how to club it together, how to make it much smaller, so I will able to deliver results in the midway rather than focusing much on taking history only.
Okay, great. Good question. Thank you, Shreya. So, what you basically need to focus on is you need to focus on the objectives, the goals that I just talked about. Because while they are rambling on for their history that you are going to be taking in the one session, not just the one session, but a couple of sessions that are coming in, every time some new information is going to be delivered, and creating those goals out of what they're telling you is the highest important factor, because in the coming sessions, that's what we want to work on. Also, like you said, how do we make them feel that they're going away with something more productive? And by the end of this seminar, I'm going to tell you what are the certain tools that you need to give them by the end of the session, so that they feel that yes, this is a structured way of proceeding and I want to take care of these certain things in the coming few sessions. Okay.
Thank you. Thank you so much. Very
Thank you.
helpful.
Okay, let's go to building rapport like a professional. Okay. Now, very important thing is to understand that there is a difference, clear difference between fear and what happens in the reality. Now, our fear is all about what if I don't know what to say? What if the client cries? What if there's silence? Or what if I feel nervous? Now, the reality is completely opposite to what you think. Reality is about listening is enough. Like I told you, reflecting and summarizing and being present in that moment gives the client more reassurity than you can ever give through your words or wisdom, because they're coming from a space of being emotionally dysregulated. They have been going through a lot more issues that you can imagine. So, listening and creating that space of it's okay, I'm here, or I'm listening, that's also enough as a therapist in the very first session. Second thing, tears, or I tell all my clients, because a lot of times clients apologize when they are crying or yawning in the session, but I take it as a compliment as a therapist, because if the client is crying or yawning in my session, that means that their nervous system is relaxing. Their nervous system feels emotionally safe. So, trust means tears means trust basically. Okay. Silence, like I told you, silence is all about processing. They are taking time to process certain informations. It's all right. And silence also gives us a clarity into what comes after next. Because a lot of times, clients, when they're speaking, they say, now when I'm talking to you, I understand why I did this, or I understand that this was such a stupid mistake. So they themselves are getting clarity when they're talking to you. So silence is processing. And lastly, if you're feeling nervous, if you're feeling anxious, amazing, because that means you care about the client, you care about this process. It would be worrisome when you stop caring about it, when you stop feeling nervous in this relationship. So, the most important part is to take care of the holding the space together rather than thinking that, okay, what do I do next? Okay. Now, the step three that is very important is taking history without interrogating. Like I told you, it shouldn't feel that I have these questions and I need to cover them all. It should feel more flowing. The client should feel that they have the lead here, that they are able to talk about certain emotions and create that space for them, sorry, and reflect emotions while you're asking or before asking the next question. For example, I understand this could be really disheartening. Before you go into something next, let them have the space. Also, imagine if you were talking about your that hobbies. Let's say you were talking about what you like, what are your interest, and I suddenly ask you, how many family members do you have? That would be weird, right? So getting a checklist ready and then going over it while history taking is not something that you would want to do, because that will disrupt your therapeutic relationship. Rather, integrate those questions in a conversational way. Make it a more gentle transition between you two, so that the client also feels that yes, it's moving forward or going with the flow. Okay, now this is a holy grail for the trainee therapist. This is a very important and very, I will share all of these things with the PDF with you guys, don't worry about that. This is a breakthrough questions that I create for therapists, especially the trainee therapist, with clients that go maybe silent, that are who don't share much, or they are not talking about anything, or they don't know or don't have the clarity of what they are here for in the therapy. So these questions makes you get, as therapist, get the points or the factors or goals or objectives that you want to actually work on. And this works wonder, let me just tell you, with all the clients, because things that they never thought were there, when you ask these questions, they come up. So especially with the teenage clients, because teenage clients, they think that they are being brought with their parents and they're just here to sit and get their time done, but they don't understand that what the process is going to lead up to. So these questions help them to bring up those issues. So for example, There are questions related to regret or loss. There are questions related to anger. There are questions related to whose attention you crave more, mothers or fathers, which tells us about the dependency or the attachment styles. So these questions works wonders. Okay, you can go through the questions and let me know if there are any questions that you have for me. No questions? Okay, let's move to the next. Now, we are coming closer to the end of the first session, which means that we want, like Shreya also questioned, that what can we give to the client that feels more concrete in nature, and they also feel that we have ended with something more productive or something new. So, first therapy session, we don't go into a lot more details and how things go, but these are certain things that you can introduce them, especially for example, if you are a therapist who works with CBT more often, letting them know what this CBT triangle is, how we go from thoughts to feelings to behaviors or actions, and how we navigate and change those certain things. So, this gives a concrete idea to the client that yes, I'm in a structured program where I will have some clarity into how to go about my issues or problems, and they feel much more emotionally secured in this process. So, if you have the space in the first session, by the end of the first session, you can give these micro interventions by the end of the first session. Like I told you, we can introduce the CBT triangle where we're talking about the thoughts, feelings, and behavior, and how we majorly as therapists first focus on the thoughts and what are cognitive distortions. Then we go forward from that to the emotions and feelings, and that leads to a different change in our behavior. If you are dealing with clients who have anxiety attack, panic attack, or anxiety related issues, or even um, disturbances in their moods, or even restlessness, you can let them know about the anxiety cycle, which starts from the trigger, leads to the thought, then the feeling, then the avoidance, then comes the temporary relief, and next time when again the trigger comes, the anxiety becomes stronger. So letting them know that anxiety is not the problem. The problem is the avoidance cycle, that we are avoiding it, which is creating a temporary relief. And next time the anxiety is 10 times higher. So CBT or therapy helps them to break this cycle and create much of a long term relief rather than a temporary relief. To help with that anxiety, you can also introduce a grounding technique, which we call it 5-4-3-2-1 technique. I'm sure a lot of you already know about it. This is one of the examples of the grounding techniques, works wonders because it brings you into the present and now. And we all know as therapists that anxiety is all about future worries or the past worries. So every time there is a peak of anxiety, you can let them know they can practice 5-4-3-2-1 technique, and instantly their anxiety will drop down. If you are not aware of the 5-4-3-2-1 technique, 5-4-3-2-1 is involving all your senses into this reality, bringing them in the present moment and becoming mindful of your situation. Okay. So these are certain tools that you can and micro interventions that you can introduce in your first session. Any questions here?
Yeah, I have one.
Yeah.
So, in the very first session, we definitely creating a rapport, and the way you have explained it, it gives me a kind of knowledge that how to go about it. Can we give homework in the very first session? Because even we want that the client also comes up with the basic triggers we have already established, a basic rapport, and the basic predisposition of the factors that we are entertaining. It's already there. So, should we give a sort of homework, keeping that in mind? CBT works on the part. So will that work in the very first session?
Yeah, so again, that depends on the client, because if you think that the client is more hesitant to the whole process of therapy, then we avoid giving homeworks in the very first session. But if you think the client is welcoming and open to the process altogether, then it's better to let them have not a homework per se, but a reading about that, think about what we've just discussed, or maybe go over the grounding technique, or practice it in your own time and let us know if that works for you. So, yes, it depends completely on the type of client that you're dealing with. And if they are more skeptical of the process, then I would avoid giving homework in the first session, because they will feel that, okay, there are now again, they will feel like a classroom feeling. So, to get out of that mindset first itself, we will avoid doing that in the initial sessions.
All right, thank you.
Thank you. Okay, now we're coming to the end of the process, and this gives us more clarity by the end that therapy always and every time feels like a straight line. We think that a problem comes, we go to a therapist, everything becomes better. No. Therapy will always be a process of there will come better, and then it will go down, then it will again go up, then it will again go down, because you are getting to know your own emotions, your own patterns. Sometimes the clients also become dismissive of the whole process, because they think, why do I have to do all the work? Why do I have to work on certain patterns and sit with those emotions, negative emotions, sit with those negative feelings, while the other person gets to take benefit of me? So all these skeptical questions come in the process, and eventually they start understanding the pattern and practicing certain skills. Then if down the line they start becoming used to the process of that, okay, these certain things that we talked about, they actually do help and help me create certain boundaries where I can know what I need to deal with and what feels good to me. And that's how we move forward in therapy. So it's very important for you as a therapist also to have that sensitivity that there will come an up and down. Do not get disheartened as therapists that, okay, the client may be relapsed, or emotions are coming back, or memories are coming back, so I, as a therapist, I'm lacking. No, it will take time. It's okay. The client is also navigating their own process. Okay, now we're open for the final question and answer round. I want all of you to ask questions, or what did you take away from the therapy session seminar today? I want to hear things. Yes, yes, Ananya.
Ma'am, actually, I have one question. Nowadays, client usually like search their symptoms and using AI, ChatGPT and all, they tend to self-diagnose. And they came and be like कि हमें ये है आप बस treatment बताओ या how to manage this. तो उन situation में how to respond? Like they already made up their mind कि उनका diagnosis ये है.
Hmm. Okay, good question. This is happening a lot कि clients already diagnose करके आ जाते हैं, chat GPT से पूछ के आ जाते हैं, and they are like कि chat GPT has already told me I have BPD or I have bipolar, so you tell me how to work through it and navigate it. We are not going to confirm that diagnosis nor dismiss it. We are just going to let them know, even if you have that or you don't have that, there must be certain symptoms, right? So we as therapists help them to process those symptoms. मैंने आपको स्टार्टिंग में ही बोला, हम डायग्नोसिस पे इंक्लाइन नहीं करेंगे. डायग्नोसिस क्रिएट अ नैरो विजन कि इस वे में जाना है, लेबल हो जाता है. लेबल नहीं करना है. रादर इफ दे आर डूइंग themselves, you tell them that you are trying to label yourself in certain way, which is not healthy. Let's talk about what issues you're having and see where it inclines towards. Let's see how therapy helps you, what patterns help you. So don't put your mind into that one box of a diagnosis. It's very important.
Okay, ma'am. Thank you.
Okay, thank you. Rolly, any questions from your end? Manisha, yes, tell me.
Hi. So, my question is, at the beginning of a session,
Mm-hmm.
uh, there's sometimes we can observe some transference as well. Like maybe the client thinks that the therapist is some sort of savior, or on the opposite end, they might think that we are the villain in this scenario. So, how do we handle instant transference in that case?
Hmm. Okay. That's usually less likely to happen in the first session. वो usually it happens in the later down the line of the sessions. But अगर ऐसा हो रहा है तो client को ये बताना ज़रूरी है that I'm here to give you a third person view rather than create a more validating view और जैसे आपने बोला या तो वो सोचेंगे कि savior है या वो सोचेंगे कि villain है. Savior वाले concept में उन्हें ये नहीं लगना चाहिए that I'm validating everything what they're saying. You need to tell them and let them know that I'm creating just a safe space here and letting them know as a third person view what is right for them and how they can proceed forward. Now, second thing, when they're thinking of the villain factor, वो सोच रहे हैं कि आप villain हो या आप सब कुछ उन्हें ही बोल रहे हो change करने के लिए या you're attacking them, that means that is also a cue for you to take a little step back and also let them have their space because they are feeling you're getting too much on their space. So it's a cue for us as a therapist to let them know that it's okay, I understand. I'm glad that you communicated that. But what I'm trying to do is create a space where you are understanding कि कहाँ पे प्रॉब्लम आ रही है, कहाँ पे सॉल्यूशन है, क्या करने से सॉल्यूशन मिल सकता है. हम पाथ ले डाउन कर रहे हैं आपके लिए, कौन सा पाथ चूज करना है वो आपकी ड्यूटी है. All we can do is create those paths for you which are the most healthy paths for you in future. Okay,
Okay, thank you.
great. Any other questions? Okay. Lastly, you guys are ready for it. I always tell everybody that do not question yourself कि अभी शायद मुझे और एक और डिग्री कर लेनी चाहिए या एक और डिप्लोमा कर लेना चाहिए उसके बाद I will get into this process. No, just jump into it because जब तक आप अपने आप को उस process में नहीं डालोगे, you will not know that you're ready for it. So don't get scared or think that I need to be over prepared for this whole process. You will get once you're in that process. So just step into it, be confident, you know, and you are able to, even if as a therapist, you're able to create a regulated space, you're doing all and more and enough. Okay? So, all the very best to all of you. Don't worry, things will be great, and I will share every resources that we've talked about today in the group. Also, we will be conducting further workshops in every coming months, and you guys can let me know if there are certain topics you have in mind and you would want certain things to be covered as a psychologist or a therapist. We can work on them as well. Okay, great. Thank you so much for being here today. Thank you. Bye bye. Take care.
Thank
Thank
you,
you so
ma'am.
much.
Thank you. Bye bye.
Thank
It
you.
was
Bye
a really good
bye.
session.
Bye.
It was definitely an enriching session, Batika. I
Thank you
really
so
enjoyed
much.
it.
Thank you.
Thank you. Bye
Yeah,
bye.
thanks a lot. Very nice session. Thank you.
Thank you. Thank you. Bye bye. Take care.